Today I'm going to be experiencing my first visit to the chiropractor. I'm at Full Circle and I'm going to be meeting with Dr. Vargas and Dr. Kennedy. I can't wait, I'm super excited, so come follow me. I'm here at Full Circle with chiropractor Dr. Kennedy. Super excited to be here, and I got to tell you, Dr. Kennedy, this is my first visit to the chiropractor.
Okay.
So
Not gonna be that scary.
Yeah, awesome. Well, I'm excited. What are we gonna do today?
Today what we're going to do is we're going to look at your posture to begin with. And we're going to find out how you're standing in space, see how gravity is affecting your muscles and how your muscles are working abnormally to hold you upright.
Okay, absolutely. Well, I got to tell you, my mom always got mad at me for my posture, so I'm very excited about this.
Well, that's good.
Okay,
Posture is important.
absolutely. Let's get started.
Hello, I'm Dr. Bradley Kennedy. I'm a chiropractor here at Full Circle, a collaborative health approach. As a chiropractor here at Full Circle, I work with mainly posture and balance, and quite literally putting your head on straight, wanting to get your body functioning in the most balanced position possible so that your muscles can relax and work together to hold you up properly. That way you get to feel better. What we're going to have you do is stand up here and just slide your heels back into the slots.
Okay.
Toes on the lines, looking straight ahead.
Okay.
Not bad. So your head's tilting a little bit off to the left, looking pretty much straight ahead, slightly to the right. And we're just going to see how they're doing.
This is awesome.
So for you, we can see that the right shoulder is dropped down and has rotated back. So it's rotated back about 4 degrees on the right, and your right shoulder is 2 degrees lower than your left. I'm going to come in around your waist now, Chris.
Okay. Ooh, it's comfy.
All right, so again, so we're still looking off. I want you looking straight ahead.
Okay.
Okay, so your body again, your hips are rotated back actually a little bit more, and it has dropped down a little bit more as well on the right-hand side. So if we come back to vertical here, and your body is also leaning off to the left-hand side, so that for you, Chris, you're putting a lot more weight on that left leg than the right. So your body's working harder to hold you upright. Okay?
That's awesome.
Why we focus on the head
Yeah.
is the average head is 10 to 15 pounds.
Yeah.
So 10 pounds here, if we're holding this up all day long, if it is off balance, your body has to twist to hold that up. So if you try and hold that
Whoa! It's only 10 pounds?
that's 10 pounds. So that's
Jeez.
what your head weighs.
That's
so
incredible.
your body's working to hold that up upright all day long.
Wow.
So that's why your posture tends to deviate.
Yeah.
Okay, Chris, so let's take a look at what this looks like.
Okay.
So come on over here. So what we're looking at is the head balanced over the top vertebrae over the rest of the neck. This is what we want to see where everything is lined up properly. But in life, we have traumas, we have bumps and falls, and they can literally shift the head off of vertical. All right, now your body has to accommodate for that, and it starts to twist, and that's what we're looking at there.
Right.
So we see one shoulder that's higher or lower than the other. We tend to see one hip higher or lower than the other. We tend to see a lot more muscle tension on one side of the body than the other as well. As I said, for you, leaning off to that left side. So because of that muscle tension pulling that hip up, when you're laying down, we also get a leg that looks short.
Really?
Okay?
Wow.
So simply by rebalancing the head on top of the spine, the whole body comes back to vertical. Shoulders level out, hips level out, those muscles relax, and you feel a whole lot better.
That's awesome. So that's what mine looked like right there?
So that's what you were looking like to begin with.
Jeez, I got to get lined up straight, Dr.
Yes,
Kennedy.
You do. And so how we look at this is we take a series of detailed x-rays of the head and neck from different angles to come up with a very specific vector on how to adjust you.
Okay.
Everyone gets adjusted very differently, uniquely based on your misalignment. Your misalignment's the accumulation of your traumas.
Yeah.
You've had different bumps and falls in your life than I have, so
Yeah.
you're going to get adjusted differently than anyone else.
Okay, Dr. Kennedy, all this stuff looks awesome, but what are we gonna go do now?
So Chris, now we're going to go back to the x-ray room. We're going to take a series of detailed x-rays of your head and neck to determine exactly how it's misaligned. And from there, we're going to come back, we're going to analyze them, and we're going to put your head on straight.
Awesome, all right, well, let's go.
All right. Okay, Chris, now that we've done those x-rays, we've analyzed and gone over them, now we're going to get you adjusted. So I'm going to have you lay down on your side here.
Alrighty.
All right. We're going to balance your head on this headpiece right here.
Okay.
I'm going to bring you right up onto your shoulders so
Okay.
you're nice and square.
Okay.
Okay. And this is going to be a very light touch right behind the ear here.
Okay.
Okay, so I'm going to lower you down just a little bit. And then what I do is I take some measurements. So everyone gets adjusted differently based on those x-rays. So I'm going to come in. And it's going to look worse than it feels, but it's just going to be a nice light touch like that. Okay? I'm just going to do this a series of time. Your head should just feel like it's rolling over. So we're going to see what changes we made. If you remember when we started off, we checked your legs and we found your left leg a half inch short. So we're going to see if they've evened out now. Excellent. And your legs have come back to even now.
Okay, Dr. Kennedy, that actually felt pretty good. So what now?
Good. So now that we got you adjusted, we have your head back on straight. Now we're going to look at the rest of you as well. So we're going to go see Dr. Emil Vargas. He's going to do some muscle testing with you, make sure everything's balanced out that way.
Awesome, let's go.
All right.
All right, I'm here with Dr. Emil, and we're continuing my visit to the chiropractor. So, Dr. Emil, what are we doing now?
Okay, Chris, so you've seen Dr. Bradley, and he assessed your neck, and he treated you for it, right?
Yeah.
So now what I'm going to do is I'm going to focus on your knee, where you said you have a previous injury.
Yeah.
And we're going to have you lay down on your back, and then I'm going to muscle test you, make sure the muscles are intact, and we're going to have you touch your knee where it feels you had the injury.
Right.
And that's called therapy localizing.
Okay.
And then if your muscle goes weak, it means you have an old injury that your nervous system has not adapted to.
Right.
So what we're going to do is we're going to reset your system, and then you should not have that weakness anymore. Hi, my name is Dr. Emil Vargas. So I do applied kinesiology chiropractic here at Full Circle. So what that focuses on is using the muscles to find imbalances in the body, whether that's subluxations, which would be when a bone goes out of place, nutritional imbalances in your organs, and that's how a lot of the body operates, in the muscles too. And then also the emotional component that goes along with injuries. So you can actually check muscles with patients when their emotions are off.
Now, Dr. Emil is going to check my range of motion. Is that right, Doctor?
That's right.
All right, let's do it.
Okay, so what I'm going to do is before we treat you, we're going to just do a little test just to make sure that we get improvements after we treat you.
Okay.
So I'm going to check your range of motion in your shoulder.
Okay.
And we're going to check it for pain too. Okay.
Awesome,
So
let's
you
do
just
it.
let me know how you feel.
Okay. Yeah, that's pretty
A
good.
little bit stiff there, huh?
Yeah, a little stiff, yeah.
Okay. So now, Chris, what we're going to do is we're going to do the muscle testing.
Okay.
And we're going to do the injury recall treatment of AK to see if you get better. Okay, Chris, so what we're going to have you do, we're going to check your latissimus dorsi, make sure it's strong, and we're going to use that to assess your knee injury.
Okay.
All right, so what I'm going to have you do, just bend this, straighten this elbow out, get your palm facing out, and then I'm going to pull your arm out this way, and I want you to resist when I say hold.
Sure.
Okay, so keep your arm right at your side there.
Okay.
Get ready and hold. Okay, good. So the muscle's nice and intact. So what I want you to do, bend this knee for me, please.
Okay.
Take this hand and touch the area of your old injury. So what we're doing, it's called injury recall technique.
Okay.
So what it does is, we're gonna fix an old injury that causes neurological malfunction in the body.
Okay.
So it's just kind of like an old injury that caused your nervous system to not really work as well as it should. So what we do is we kind of reset the body so that everything flows properly.
Okay.
Okay. So hold that area and then turn this hand out. Okay. Touch your teeth together for me, please. And then hold nice and strong. So now your muscle kind of got a little bit weak. So we know there's an old injury there that we need to fix.
Okay.
So I'm gonna have you do, you're gonna keep holding on to there.
Okay.
Or actually what we'll do is straighten this leg out.
Okay.
Can you kind of bend, sit up for me?
Yeah.
Touch your knee for me.
Okay.
Yeah. Straighten the leg up. So I'm gonna kind of bend your, what's called dorsiflex your foot.
Okay.
So I'm just gonna do these little manipulations.
Okay.
And then we're gonna retest it. Okay. Okay. Lay back down.
Okay.
All right. Bend this knee again. Touch that point. this arm out. Now hold there nice and strong. Okay. You notice the difference there when I did it the second time?
Yeah, I did.
How much stronger it is?
That's awesome.
Yeah, exactly. So that is one of the things I do here in this office called the recall technique. And it's a technique that was developed by a guy called Dr. Walter Schmidt that he learned from a podiatrist. Because they found that a lot of injuries are actually associated with the feet. Okay, Chris. So now what we're going to do is now that we've done the test on you with the injury recall technique, we're going to recheck your range of motion and your pain threshold and see if it's improved.
Okay, absolutely. Yeah, let's do it.
All right, ready?
Yeah. All right, yeah, that feels much better.
Good.
Yeah, that really worked, doctor. I really like that. So is my visit at the chiropractor done today?
Yeah, we're done for today.
Okay.
But obviously I want you to follow up with us. So I want you to come in next week. We want to make sure that your range of motion is still good and your pain is down. And I want to make sure that injury in the knee is completely gone too and you have no more pain.
That's awesome. Well, Dr. Emil Vargas, that's awesome. My first visit at the chiropractor today was completely awesome. I got to learn and experience some things I've never done before. So I'm your host, Christian Collin, with Fashion and Lifestyle. Thanks for watching.